menos espesa.
I'm originally from Medellin, Colombia. My family immigrated to the United States in the 90s. Spanish was the only thing spoken at home.
One of my earliest memories in healthcare is serving as an interpreter for my family. I was asked to tell my mother that she had cancer when I was just a child.
My little brother was born, and I remember it was like, how much is he eating in a day? I think in the Spanish language, we tend to be a bit romantic and say, oh, he's not eating anything. But really, she's just meaning to say he's eating very little or he's a very picky eater. And so that kind of started an issue with the provider thinking that my little brother wasn't eating. It was a big issue, but really, because I didn't know any better. My mother said he's not eating, so I said he's not eating.
That was an event that really stayed with me. Number one, because of course she didn't end up having cancer, but it was probably information that was inappropriate for me to have at the time.
The amount of Spanish-speaking patients around here, it's a lot. I'm a Spanish medical interpreter. We actually sometimes can't even get to all of them. We have to get assistance from the video remote interpreters, sometimes from the phone lines.
The Medical Spanish Interest Group is open to all of the health science community. When it comes to medical terminology, like technical terms, or even just trying to rephrase something to help a patient understand, that's where we need practice to be better providers in the future.
Communication is key. Knowing all the medical talk is already very difficult, so adding a communication barrier makes it even more difficult.
We reviewed vocabulary that was relevant to the case, and we partnered up, and one student acted as the provider and the other student acted as the patient. So they were able to really walk through a real-world scenario.
If you can grow your language skills, fantastic, but always have a good awareness of the edge of your skill set. And when you hit that wall, you definitely want to make sure that you're calling for the medical interpreter, and never, ever, ever use children if you can avoid it. This is a great example of the heart of our Brody students in that they really care about providing good clinical care to our local community.
I think it's a very useful skill to develop good rapport with your patient, because that means you've taken time to learn about someone else's culture, someone else's language, and that means a lot to someone who feels like they're just a drop in a bucket.